Did you know that poor choice of medical equipment can endanger the lives of healthcare worker or patient? This is a story about Jessica. She is currently the sales manager for False Pharma that sells personal protective equipment, PPE. PPE has become a highly needed medical equipment in the middle of COVID-19 conditions. Jessica receives information that one of the privately owned hospitals is conducting a tender for PPE procurement. Since PPE is in high demand, the hospital rushed the tender and failed to perform adequate quality checking on the quality of the PPE offered by False Pharma. Jessica took advantage of the situation. She bribed the hospital's procurement to favor them in the tender. To reap higher profits, she also supplied PPE with low standard quality. In the end, False Pharma won the tender. False Pharma supplied for all PPE needs for the hospital. Richard is one of the doctors at the hospital. He complained to the hospital that the PPE are of very low quality. It tears easily and the size is too small. Due to urgent need, and since the PPE are already ordered at large quantity, Richard and the other doctors have no choice but to use the PPE to handle COVID-19 patients. Until eventually, Richard and several other doctors were infected by the COVID-19 virus from the patients they were handling. This is due to lack of protection from the PPE they were wearing, allowing the virus to infiltrate their bodies. The hospital lost most of the healthcare workers capable of handling COVID-19 patients, since they were also infected due to poor quality PPE. Previously, other patients were also infected by the sick doctors. This story would have had a 180-degree difference in ending, if only the hospital and supplier had integrity and transparency in performing the tender and providing the best products. Integrity and transparency are required in all aspects. With strong integrity, the vendor should not have given gratification and benefit to the hospital's procurement division, so that the tender can be performed fairly, transparently, and with maximum results. Furthermore, vendors are supposed to provide the best medical equipment according to the contract, not by decreasing the quality to gain more profit from the price margin. If everything was done based on compliance, then the performance of the hospital and healthcare workers would be optimized so that the patients and the healthcare workers would have been spared from COVID-19. Not just Richard, millions of other patients and healthcare workers would have been saved by implementing integrity and transparency in the healthcare sector.